In 2012, one of the things that was standing out as a growing cost for us is our healthcare cost. It wasn't just the cost of the company, but we were passing along an increasingly large cost to our employees, and that number was growing around 5 to 6%.
We weren't much different than any other large employer with respect to healthcare. We didn't really know what the costs were and where they were coming from and what was the health of our population.
Without providing specialized programs, our employees' health was suffering. We needed to make employees aware of what were the risks of various uncontrolled conditions.
Triple aim is to have lowered or reasonable cost of healthcare, improved outcomes, and an improved experience for the members. And our rule is that anything we do is going to have to improve one or all three of those things and not degrade any one.
One of the great products we have in this company is called Blueprint for Wellness. And with that as a baseline, we then could find individuals that had health issues.
That is an annual measurement of key diagnostic indicators of your health: blood pressure, body mass index, cholesterol. If you know those core diagnostic insights, you can own your health.
It's extremely difficult for an employee to make the right decisions in healthcare because they don't have the data. So we fundamentally changed that and said we're going to give you results and hook you up with a physician for a conversation and referral into the right services.
If I didn't work for Quest, to be honest, I most likely would not be sitting here speaking with you. Found out through the wellness program that I was actually diagnosed with end-stage renal failure. It was a wake-up call. I'm healthy. I'm no longer on dialysis through this program because I was able to act fast. June of 2019, I was the proud recipient of a kidney transplant, and I'm truly grateful for that.
We've really tried to take a curated approach to offering different programs based on where an employee is in their healthcare journey.
We've put together programs around weight loss, around thinking about diabetes and better care for themselves. And all those programs require good data, good insight, and great action.
The diagnosis I had received from my local hospital saying that I had rare bone marrow cancer as well as a blockage in my heart, that they couldn't do anything for me. Quest had a program which could give me many opinions from the top thought leaders in the country. My doctor told me when I woke up after the surgery that I had hours to days to potentially a week or two to live. Quest is such an amazing company that put the time, the effort, and the money towards a program like this.
I was able to utilize the health plan with Quest. They offer multiple tests. One of the tests that was really important to me was the Insure One test. We're very fortunate to have an employer that actually does care about our health, not only to be healthy in the workplace, but also be healthy for our family.
We put in place an aggressive program around mental health that says an individual can access mental health services with Johns Hopkins by answering a questionnaire and then privately engaging with a counselor. And this approach destigmatizes what's going on, which I think has been totally critical. This is only 10% done. There's still a huge amount of complexity and waste in our own health plan that are unacceptable.
We started on this, frankly, I really felt like we're just like any other company, but today we're not. And I have example upon example of people that understood that if they didn't start taking action with some of the results they're seeing, they would be going in the wrong direction, having catastrophic issues. So I couldn't be more proud of what we've done as a company and what we've done to really change things for our employees in a very positive way.